Alright, I'm going to go through an entire FMX here, starting with what I like to start with is the upper right side. So set up for that. You have the rod here. I imagine you fish hook the patient. That's how it goes in the right side. And so if I want to get the upper, I angle this to where it's going to the upper. So see that? And then the ring just has to match to where you see the ring directly through here. If I flip it around, then that's the wrong way. So this has to go up to match where the sensor is going to be held. And then the last step here is just make sure the cord follows the rod. You can see this is the part that moves, so you push it in the part that moves. Center the sensor in here. It's a little off center, so that should be right in the middle where you're seeing. Now this is Bruce, our mannequin. He's very cooperative, zero gag reflex. Going to be a little bit more difficult in a real patient, but just to show you the technique here. So to put it in the mouth, I'm starting with the upper right molars. I'm going to kind of scoop it in, because what happens if I try to just shove it in, it doesn't fit. And so you scoop it in like you're feeding a baby. And then, I don't know if you can see from this side at all, but to center it, so I'm trying to center that as far back as I can, which in a real patient, they're going to have a gag reflex. And about as far back as you can get is about the distal of the first molar. And so the center of that bite tab, if I can get on the distal of that first molar, I'm happy. If you can get between first and second molar, that's good. Right now it's about between first and second molar. Slide that in. Alright, I'm going to stand back a bit. I'll go ahead and expose this. I just line everything up parallel. So I'm going right through the ring. The angulation, so both the vertical and the horizontal angulation should be parallel with the rod. And if you look at the image, it looks pretty nice. Got both of these molars. If you had a third molar, I would have seen it there. I even got the second premolar. So we can just go ahead and move on to that premolar shot. Alright, for premolar, just have them open up a little bit. You don't even need to remove this. You know, if they're struggling with it and they need a break, you can take it out. Bruce is doing fine though, so I'm just going to move this as far mesial to where the center now is on those premolars. And I feel the top of this kind of contact the anterior left side of his palate. So there's only so far anterior I can go, and I'm going to do a lot with rotation, so you can rotate it back and forth. But I'm going to rotate where it's roughly opening up that premolar contact. You keep it in there deep. One problem I see doing any radiograph is the students try to put it real close to the teeth, and then it's banging on their hard palate. The patient has a tough time closing, and everybody gets angry. And so if you move that more in the deep part of the palate and just rotate from there, you're going to get a lot. It's going to be easier on your patient. You're going to get a lot better images. And then again, I'm just imaging parallel right through the ring. Give me a good premolar. That looks great. Alright, so now we're going to go kitty corner. We're going to the opposite side on the lower. As you see, it was set up like this, but if you just flip the whole thing over, it's set up for the opposite side mandible, the lower left side. Have them open up. Again, I'm looking at the center of this bite tab. I want that centered toward the distal of the first molar. Maybe in that contact, if I can, between the first and second molar. I hold that in place and have it bite down. You have it more in the center of their mouth so they're able to bite down. Then we get the nomad. And then again, if I have it lined up right, you can just do everything parallel. This is lined up kind of a steep angulation, so I might come up a little more vertical. And if I'm ever not lined up perfectly parallel, you want to ignore where the ring is and you aim at where the sensor is. So I'm going to aim where the sensor is. I can see the sensor in his mouth. And hopefully this one turns out. It's pretty good. Maybe I came a little too far up, but I do see beyond the apices there. I see this impacting third molar. Alright, so again, if he's tolerating pretty well, and if I'm moving fast, they're usually pretty tolerant. I just slide it forward. Just kind of do that rotation. Keep it deep in his mouth. Make sure he's bit down all the way. And again, I'm going to try to do it parallel if I can. See how that looks. Alright, good. Got those apices. Now I need to switch around to the... Alright, so just pull this out of the lower left, and I want to switch it around to the upper left. And there's three things you need to switch. I always start with the ring. I just flip that around. I'm just going to go like this. Next thing is the bite tab. Now that's going down, but I want it to come up. So that's two of our three things. What's wrong here? The only thing that's wrong now is the cord is going down the back of his throat if I put it in this way. So you need to flip the sensor around. And after those three things, it should be ready. Cord coming out of his mouth. A little fish hook for the rod going into his mouth. This goes up because I'm doing the maxilla. And the ring centers right on the sensor. Okay. And then the technique is just the same as the other side. Where the molar shot is. Looks great. So just like the other one, so just slide it anterior. Mostly that's with angulation because there's only so far forward you can pull it before you hit the anterior palate. Line this up parallel. That's good. Alright, let me just take this out. Just like we did last time when we went crisscross. All you have to do is flip this over to the other side and it's ready for the lower right. I'm going to do premolar because that's how our template's set up. So I put that in the deep part of his mouth, then I pull it as far forward as I can. I'm centered as much as I can on those premolars. Make sure the cord's out of the way. Line it up parallel. Just keep it rolling here. I'll just move right back to the molar shot. I do see a third molar in there. I'm going to try to get on that second molar if I can. Get it centered on that and hopefully capture some of the third molar. Alright, how are we looking? Pretty good so far.